Hello everyone. Next, we will learn about the care of coronary heart disease, CHD. The full name of CHD is coronary atherosclerotic heart disease. First, let's review the coronary arteries. We know that the heart needs to beat continuously to ensure blood circulation. As a mechanical power organ for pumping blood, it also needs sufficient nutrients and energy. The coronary arteries are the arteries that supply blood to the heart. Coronary heart disease is a heart disease caused by coronary atherosclerosis, leading to stenosis or occlusion of the vascular lumen, or by functional changes of the coronary arteries, such as spasm, resulting in myocardial ischemia, hypoxia, or necrosis. The resulting heart disease, just like this picture shows, the diameter of the blood vessel was originally this wide, and now it is narrowed to only half of its original size. The local myocardium supplied by this blood vessel will experience ischemia and hypoxia. This is coronary atherosclerotic heart disease. In recent years, this disease has been divided into two categories: chronic coronary artery disease, CAD, and acute coronary syndrome, ACS. Chronic coronary artery disease includes asymptomatic myocardial ischemia, ischemic cardiomyopathy, and stable angina pectoris. Acute coronary syndrome includes unstable angina pectoris, myocardial infarction, and sudden cardiac death due to CHD. If a patient has typical angina pectoris or myocardial infarction, then we can basically confirm the clinical diagnosis of CHD. Next, let's look at the typical clinical manifestations of angina pectoris. The typical clinical manifestation of angina pectoris is chest pain. The location of chest pain is usually behind the sternum or in the precordial area. With an unclear boundary, it often radiates to the inner side of the left shoulder and left arm, reaching the ring finger and little finger, or the neck, pharynx, or mandible. The nature of the pain is generally oppressive, stuffy, constrictive, or burning. When the pain occurs, patients often unconsciously stop their original activities until the symptoms are relieved. The duration is generally 3 to 5 minutes, occasionally up to 15 minutes. Rest or sublingual administration of nitroglycerin can relieve the symptoms. The attack frequency can be once every few days or weeks, and some may have multiple attacks a day. Patients often have angina pectoris under certain triggers. Common triggers include excessive physical labor, emotional excitement, cold stimulation, overeating, and smoking. When these triggers occur, they will increase the myocardium's demand for blood. Due to the vascular lumen stenosis caused by the disease, the blood supply to the myocardium decreases. The contradiction between supply and demand deepens, leading to angina pectoris. Next, let's look at what myocardial infarction is. Myocardial infarction is a condition where, on the basis of coronary artery lesions, the coronary blood supply is sharply reduced or completely interrupted, pausing the corresponding myocardium to experience severe and persistent acute ischemia, leading to myocardial cell necrosis. Chest pain is the earliest and most prominent symptom. The location and nature of chest pain and nature are similar to those of angina pectoris, but the degree is more severe. During the pain, most patients have profuse sweating, restlessness, fear, and a sense of impending death. A small number of patients may have shock or acute heart failure as the initial symptom. The duration can be several hours or days. Rest or taking nitroglycerin cannot relieve the pain. Before myocardial infarction, patients may have prodromal manifestations. Often, a few days before the onset, there may be fatigue, chest discomfort, and during activity, palpitations, shortness of breath, restlessness, angina pectoris, and other prodromal symptoms. The angina pectoris attacks are more frequent than before. The nature is more severe. The duration is longer. The effect of nitroglycerin is worse, and the triggers are not obvious. Therefore, when the nature of the patient's angina pectoris attacks changes, we must be alert to whether myocardial infarction has occurred. So what are the related factors for the occurrence of this disease? The main risk factors include hypertension, dyslipidemia, hypercholesterolemia, diabetes mellitus, and abnormal glucose metabolism. overweight/obesity, type A personality, genetic factors, and unhealthy lifestyle, including high fat and high cholesterol diet, smoking, and lack of physical activity, it can be seen that coronary heart disease is the result of the combined effect of multiple risk factors. Among these risk factors, except for type A personality and genetic factors which are non-intervenable, other factors such as hypertension and hyperlipidemia are mostly modifiable and controllable. In view of these risk factors of coronary heart disease and the characteristics of coronary heart disease, we mainly carry out care from the following aspects: adjusting lifestyle, guiding patients in rehabilitation exercises, actively treating related diseases, and mastering emergency treatment. As we introduced earlier, an unhealthy lifestyle is a common risk factor for chronic diseases such as hypertension, diabetes mellitus, etc. And hypertension and diabetes mellitus are major risk factors for CHD. Therefore, adjusting lifestyle is the basis for disease treatment. It is recommended that patients have a reasonable diet, with special emphasis on low salt, low fat, low cholesterol, and low calorie, and increasing dietary fiber intake, control body weight, and at the same time quit smoking and limit alcohol intake. Conduct self-psychological adjustment and reduce mental stress. Formulate an activity plan for the patient and guide the patient in rehabilitation exercises. When angina pectoris occurs, the patient should immediately stop activities and rest. Patients with unstable angina pectoris can rest in bed. For stable angina pectoris, exercise should be regular, moderate, and persistent, and carried out step by step. Choose low-intensity aerobic exercises, such as walking, broadcast exercises, etc. During the activity, we should closely observe and ask the patient to pay attention to their own feelings, such as palpitations, chest tightness, chest pain, and dyspnea. If such symptoms occur, the patient should immediately stop exercising. Take nitroglycerin sublingually and receive oxygen therapy. If the symptoms cannot be relieved, the patient should seek medical attention in a timely manner. When angina pectoris occurs, the patient should immediately stop activities and rest. CHD patients usually take some drugs to improve myocardial ischemia, to relieve symptoms, to prevent myocardial infarction, and to improve prognosis. Caregivers should understand these commonly used drugs and assist the patient in taking medication as prescribed by the doctor, without increasing or decreasing the dosage without permission. Carry nitroglycerin with them when going out. For emergency use, nitroglycerin is easy to decompose when exposed to light, so it should be placed in a brown bottle and stored in a dry place to prevent deliquescence and invalidation. The medicine should be replaced every 6 months after opening to ensure efficacy. If the patient has hypertension, diabetes mellitus, hyperlipidemia, obesity, or other diseases, active treatment should be administered to control blood pressure, blood glucose, blood lipids, and body mass index, BMI, at ideal levels. At ordinary times, it is necessary to avoid excessive physical labor, emotional excitement, cold exposure, overeating, strenuous defecation, and other such triggering factors. Teach the patient to master emergency treatment measures. Require the patient to carry nitroglycerin with them. And when going out alone, carry an emergency card. When angina pectoris occurs, rest on the spot and immediately take nitroglycerin sublingually. Sublingual administration is a way to enable rapid absorption of the drug. Patients and caregivers should master the usage. When taking the medicine, place it under the tongue, let it dissolve and be absorbed naturally. Do not chew it, and do not swallow it. Generally, sublingual administration takes effect within 2 to 5 minutes. After medication, the patient's sense of oppression or pain in the precordial area will be reduced or disappear. If conditions permit, quickly give oxygen to the patient. If the symptoms are not relieved, send the patient to the hospital in a timely manner. When myocardial infarction is suspected, send the patient to the hospital in the shortest possible time to recanalize the occluded blood vessel and save the myocardium. After coronary artery occlusion, the changes in the myocardium have a developmental process. Within 20 to 30 minutes, a small number of myocardial cells supplied by the vessel die. Within 1 to 12 hours, most myocardial cells undergo coagulative necrosis, with interstitial congestion, edema, and inflammatory cell infiltration. Within 1 to 7 days, the necrotic myocardium gradually dissolves, forming myolytic foci, and granulation tissue forms. Within 1 to 2 weeks, absorption begins, and gradual fibrosis occurs. Within 6 to 8 weeks, a scar is formed. Therefore, within 3 to 6 hours after the onset of the disease, and at most within 12 hours, the vascular recanalization therapy should be implemented. That's all for this section. Thank you all.